Just so everybody knows, we're now live streaming, and we're actually going to start our meeting now, and we'll start with the Pledge of Allegiance. Ready? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, that's very difficult if we don't all mute. Again, good morning, everyone. It's a pleasure to be back. It's sadly, we're doing this live stream again, and for everybody's information, we are live streaming this for the public, and it is obviously it's being recorded. I got some house cleaning things to do, but first I'm going to ask Senator Carrozza. Has everybody muted, by the way? Okay. All right, I'm going to ask Senator Carrozza if she would please lead us in prayer.
Thank you, Mr. Chair. Heavenly Father, we thank you for this glorious day, and we thank you for your goodness. From Psalm 34, we will always thank the Lord. We will never stop praising you. We will praise you for what you have done. Proclaim with me the Lord's greatness. Let us praise his name together. Heavenly Father, we ask you to bless our Eastern Shore delegation members, their families, and all those participating in today's Zoom. Bless our work together as we pray to do your will in service to God and the people we represent. In Jesus' name we say together, amen.
I'm sorry, good morning. Somehow I got muted. I did that myself just for you. Before we get into treasury report, I just want to give everybody a welcome, and I also want to talk briefly about how we run our meetings. I know we got some new members here, new people visiting us. Typically, this is an information gathering meeting for the delegates and the senators. We're going to have a presenter. Our presenter today is going to be from the Maryland Department of Health. And for the audience, we don't typically entertain questions from the audience. You can submit them. If we can get to them, one of us can pose that question. But if you have questions after the meeting, please get in touch with your delegate or one of us, and we can probably find that answer out for you. From the senators and the delegates, any questions before we start? Okay, save that. I think we have Delegate Chris Adams. He's going to give us a treasurer's report.
Thank you, Mr. Chairman. And so beginning balance on January 1st, 2021, $3,076.49. There was one check written this year for the funeral of our dear friend and colleague, Delegate Wayne Hartman's mother. That was for $100. There were service fees of $27, interest earned of a whopping 30 cents, giving our end of the year balance of December 31st, 2021 of $2,949.79. So that is your treasurer's report, Mr. Chairman.
Well, thank you. Appreciate it. Okay, well, that being said, let's jump right into our agenda. Today we have the Maryland Department of Health. Is Dr. Chan available?
I just got a message for her. I have to send her the Zoom link. She did not get it.
Okay.
Oops.
Okay, we can do that. Well, let's, any business that the delegation wants to discuss beforehand. Senator Carrozza, you had a request about a letter to the governor.
Yes, thank you, Mr. Chair. Delegate Hartman and I met with the leadership of Coastal Hospice on January 5th to receive a pre-session update. And at this meeting, we were made aware that the current makeup of the Maryland Healthcare Commission does not include appropriate Eastern Shore representation. It was also brought to our attention 4 of the 15 MHCC positions are set to expire in September of this year. So the request is to have the Eastern Shore delegation send a letter to the governor, and I did send you a draft that could be circulated, Mr. Chair, that at least one member be appointed from the lower Eastern Shore, Dorchester, Somerset, Wycomico, or Worcester. There currently is a member serving from the Upper Shore. And this is to ensure fair representation on the commission. We will have a number of specific rural issues impacting us on the shore. And this is an opportunity with these 4 positions up in September for us to have increase and have fair representation from the Eastern Shore. And I have talked, Delegate Hartman was in the meeting, and also I have talked to Senator Eckert, who has also been working these issues with Coastal Hospice as well.
I had sent that letter out to you all for your review. I don't see a problem with it. I think it's a great idea. I think we do need that type of representation throughout. I don't know if you all want to take a vote on it because I don't think any of you have read it yet, but perhaps we can do a vote over the, send me an email that you're for it or against it. And we can do that maybe after this meeting. Any questions on it from anybody?
Mr. Chairman,
Yes, ma'am.
Eckert here.
Yes, ma'am.
We've had this discussion before through the Eastern Shore delegation, if you remember, and what we might also want to do, if there's room in the schedule, is bring in Mr. Stefan and talk about these issues.
Okay, I'll put that in the page. Good. Okay. Any other comments on the letter from the delegation?
Mr. Chairman.
Yes, sir. Senator Hershey.
Certainly all in favor of it, but I would maybe preempt that by checking with Secretary Cavey on how appointments work throughout the last year of an administration. As I understand, there are some appointments that cannot be filled actually after a primary date, and some appointments that for terms ending after July 1st may not be able to be appointed as well too by the administration. So you might want to just check that, but I certainly am in favor of getting as much representation on the Eastern Shore, from the Eastern Shore, as possible.
Okay, good idea. Thank you, Senator. Okay, I think we have Dr. Chan. Would you like to go live on your video and unmute yourself?
There we go. Good morning. I apologize. We realized too late, even though it was on our calendar, we didn't actually have the Zoom link. So thank you to you and your staff for working so quickly. Can you hear me okay?
Yes, I can.
Great, excellent. So I am joined by my colleague, Heather Scheck, the Director for the Office of Government Affairs, and we have just a few brief slides to share with you. So I want to make sure that we can get that up and running. Let me just check. Heather, are you working on that? Do we have share ability on the Zoom?
We do not.
Okay.
Can the host enable sharing?
I think you should have a sharing ability right now, Dr. Chan. Is that correct? Are you there?
It would be
sharing your screen.
okay. Is it for me or? Hold
Yeah,
on,
I
let me
think
try.
I've given you the ability to share.
Oh, okay, gotcha. All right. Well, let me. I was hoping that Heather could do it because I'm trying to manage. Hold on. Oops.
Somehow I've really got my display done right. Marty, can we new share? Let me see if I can.
To Heather Scheck, if that's possible.
I'm trying.
Yes. No, my apologies to the delegation members. I will try to make sure to go through our slides as quickly as I can to make sure that there's time for questions. I know there's a lot of questions.
You know what? Let me work. I'm starting to work through this. If you want to,
Go ahead and start.
yeah, I would do that.
Okay, great. I will do that. So, well, good morning to members of the delegation, to the chair of the delegation and members. And first and foremost, Happy New Year. it already seems that we're well into January and maybe a little late for New Year wishes, but I am still an optimist, and I think that even despite some of the situations that we are seeing now here in Maryland and in our communities, that we are continuing to work towards continue to respond to the COVID-19 pandemic here in the state. I am joined by my colleague Heather Scheck, and so we'll get those slides up as soon as we can. But as of today, our focus has been vaccinate, 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 but also, now more recently, focus on boosters as well as testing. And I'll talk about all of that as well as the hospital surge and other measures that we are taking from the Maryland Department of Health and actions that the governor has taken recently. So as of today, there's about 750,000 eligible Marylanders who have not gotten vaccinated yet. That includes about 334,000 adults and 413,000 children, 5 and up, who are still unvaccinated. In December, of the approximately 5,500 Marylanders who were infected with COVID that were then admitted to the hospital, about 62% were unvaccinated. And similarly, 63% of the deaths that were reported in December were among unvaccinated individuals. And so it is, vaccination continues to be a major initiative and a major tool for us to prevent hospitalization, severe disease, and death. We now have, all the tools, resources, and strategies in place to protect ourselves, and every Marylander, we are encouraging to use them and to exercise common sense and take precautions to stay out of the hospital. And I'll talk in a little bit about our hospitalization numbers. So, parents and guardians of unvaccinated children 5 and older need to get their kids vaccinated. That's something else that is top of mind for all of us. Schools have gone back in session after the holidays, and so I know it is a concern for many parents about, is it safe for my child to go back to school? And the answer is yes, especially if they've been vaccinated. And this is something that, of course, I have kids in this age range between 5 and 11. I have a 6-year-old and 11-year-old who previously could not be vaccinated. And so it was one of the first things that I did, as soon as I could get an appointment to get my kids vaccinated. And while the risk is not zero for kids to go back in school, I feel very confident that with the vaccines, and they've gotten both doses by now, that they are much safer because of it. And as we've learned in the adult population, especially getting vaccinated and getting a booster, as we're learning more about how long the immunity lasts with these vaccines against COVID-19, getting a booster is still one of the strongest possible defenses that we have against this virus, severe illness, hospitalizations, and death. So, and then I will talk about testing towards the end because we are expanding our testing resources. We have the slides up because I think the next slide was oh, great. Excellent, just in time, because I was thinking the next slide was a graph. Perfect. So what you see here is what our current bed usage is. I think this might be a few days old right now, but it does reflect towards the right-hand side of, so this is bed utilization since the beginning of the pandemic. And so you can kind of see that we're now in, what we're calling our 6th wave of COVID. And the black line at the top shows total bed utilization. And so as we've been projecting, our statewide COVID-19 hospitalizations have reached record levels this winter. And you can see that just, by looking at where we are currently than where we were in previous waves. As of Wednesday, Maryland hit a record high of 3,435 hospitalizations related to COVID, which is an increase of more than 500% in the last 8 weeks. So just before Thanksgiving until this week, it's 500% increase. And our ICU bed occupancy is also at record highs. Again, on Wednesday, it was at 559, which is about 45% of the total staffed ICU beds. Now, we know, of course, that ICU bed capacity is much more limited. Staffing is much more intensive, hence the name intensive care. But, so that is, of course, of great concern to all of us. As Governor Hogan said in one of his briefings last week, that the next 4 to 6 weeks are going to be among the toughest that we have faced throughout this pandemic. And, we are hearing that from our hospital partners, from the healthcare workers, the frontline workers in nursing homes and other facilities, that this is tougher. And the challenge is staffing, and that's what we're facing now, is that, as we are closing in on 2 years after the first case was reported of COVID-19 was reported here in Maryland, staff are tired, and, yet we are facing the most severe increase in cases yet in this pandemic. The latest projections that the governor talked about shows that we may reach as many as 5,000 hospitalizations related to COVID, which is more than 250% higher than the previous peak that we had, which was actually on January 11th, 2021. So a year ago, a few days. At 1,952. So we are already past that this week with about 3,400 hospitalizations. Now, you've probably heard about the Omicron variant, and this current wave is largely being driven by that variant, which comprises now about 90 to 95% of total cases. So we first heard about this Omicron variant as a variant of concern just before Thanksgiving. So about 8 weeks ago, the very first case was identified in the US on December 1st, and then in Maryland on December 3rd. And in very few short weeks, it quickly overtook the Delta variant as the predominant one circulating here in the state and really across the country. And while it appears to be milder than the Delta variant, because it is so much more transmissible, what we're seeing overall is that perhaps it's a lower percentage of people being hospitalized with Omicron than with Delta, but yet because so many more people are getting infected with the Omicron variant, that's what's driving our total hospitalizations. So next slide. So wanted to go back to the vaccines discussion, in that this graph shows the cases hospitalized by vaccination status over time. And the latest data, and we don't have the December data yet. I think that's being pulled together now. We update this, I think, monthly. But you can see in yellow the fully vaccinated, and in blue the unvaccinated. And so while that proportion has increased of those who are vaccinated, the vast majority of people who are being hospitalized and who die are still unvaccinated. So with the current vaccines, and importantly with appropriate boosters, because the booster recommendations are now that if you have received a Pfizer or Moderna vaccine, one of the mRNA vaccines, that people should get a booster dose about 5 months after they finish the second dose. With the combined data, and I was just looking at this the other day, CDC has asked a number of states, if we have this data that looks at hospitalizations and are able to link it to vaccination status, and Maryland is one of them, but CDC combined data from over 27 states and showed that unvaccinated people are 10 times more likely to get infected, and perhaps as much as 20 times more likely to die from COVID-19 compared to people who are both vaccinated and boosted. And so we've taken a number of proactive measures, and just really quickly, on December 15th, we changed, we directed the hospitals to take steps to maximize their hospital bed capacity. Of course, many of them were already doing that, but, we really wanted to be proactive and have every hospital ready, and to look at this as we were seeing our numbers increase even in December, as we went into the holidays. And to try to maximize staffed med surge as well as ICU bed capacity. Just recently on January 4th, as I'm sure you're aware, the governor just declared a 30-day state of emergency. And so what that has allowed us to do, among other things, and the secretary has authorities to direct and expedite the transfer of patients if necessary, to establish alternate care sites, importantly, allowing greater flexibility of licensure for health professionals, including interstate reciprocity, allowing inactive healthcare practitioners to practice without reinstating their license, and allowing graduate nurses to work at any healthcare facility and provide full nursing services under appropriate supervision. So those are some of the things that this state of emergency allows the secretary to do, and we are exercising as much of that authority as needed to provide appropriate staffing for hospitals and other settings. In addition, you've begun to see probably more of the National Guard out and about, because we have an additional 1,000 members of the Maryland National Guard being mobilized to assist hospitals with patient transfers to nursing homes and the like, as well as assisting in setting up testing and other non-medical support. We also have stood up a surge operations center, and this really is to help identify, whether it's helping to MIMS with directing patients to appropriate levels of care or alternate care sites, or to also coordinate discharge of patients who no longer need to be in the hospital and try to expedite that and get them to a lower level of care as clinically appropriate. That's what this Surge Operations Center is doing. Next slide, please. So very quickly, and it's a little hard perhaps for folks to see this, but right now, as of yesterday, about 4.3 million Marylanders are fully vaccinated now, and we have administered over 8.8 million doses since the beginning of our vaccine campaign, which actually started December 14th, 2020. So we are monitoring this and continuing to engage in our communities. And at this point, and I've been talking about boosters, nearly 1.8 million people have received an additional dose or a booster dose around the state as well. Next slide. So wanted to, this is a little, there's a lot of numbers here, and this helps kind of give a sense of a breakdown by population. And so at the top, the 5 to 11, that was the most recent age group to be approved for vaccine back in November. And so so far here in the state of Maryland, about 37.2% of the eligible population have received at least one dose, and then about 27%, including my own, are among the fully vaccinated. And then I won't go through each of the numbers there, but you can see down towards the bottom, we have very high uptake among the 65 plus population. Next slide. So getting tested continues to be a really critical aspect of this. And I know that people are, ahead of the holidays. We did push out additional tests. And as I'll talk about in a moment, we are standing up additional sites. So we are still conducting, seeing record numbers of COVID testing, with now almost 17 million tests completed to date. These are the PCR tests, and so it doesn't even capture some the many antigen tests. Yesterday alone, there were over 63,000 test results reported to us. to support this effort, we have opened up new hospital-based sites over the past 2 weeks across the state. So these are on track to be open daily for walk-ups with no appointments. And so right now, we've expanded operations on the Western Shore in Annapolis.
Nick
And
Manis,
Prince
could you please mute?
We went, me, Nick, and Stace walked up to, we almost went to the yacht club. Oh, really? But we walked over up to Osteria.
Hey, Nick, can you mute, please? Nick Manis.
So-
Sat down, doorbell rings.
Nick, hey,
Kramer
I
and
sent you a
Valbrand.
text, Nick. Mute yourself. Nobody cares about the yacht
Stace,
club.
you know, Chris is a little flirty. Right?
So the governor just announced yesterday an additional 6 testing sites to be fully operational by the end of next week, which includes at the University of Maryland Eastern Shore and Talbot counties, as well as in Tidal Health and Wycomico County. So with the 10 announced last week, the 6 just announced yesterday, there will be a total of 18 new testing sites operating across the state by the end of next week. In addition, we are, early on as the at-home tests became more and more available, we had been supplying local health departments with these tests that were, the ones that we started with, or the Abbott tests, the Binax Now that you may have seen. And so we knew that there would be a demand for that ahead of the holidays. So even in November, we began distributing these to local health departments to get them out to communities. So some communities use local libraries, for example, as a pickup site, or their own testing or vaccination sites as a way to distribute these tests. And so they're continuing to get these at-home tests. They are in short supply across, nationally. And so, the governor has been asking our federal partners to expand production of those and expand availability as much as possible. And so at his direction, we are using all means to acquire additional tests, not just Abbott, but looking at other approved tests, and are on track to receive over 500,000 additional tests, on top of the 1 million tests that we've received prior to the holiday season. So next. So wanted to end, and I have 2 more slides. So talking about treatments, and so that's important. Perhaps that doesn't get as much play or as much discussion, but there are new treatments for COVID-19 disease, and some we've talked about, so including the monoclonal antibodies. And so these are available to Marylanders, but I will say that, again, much like at-home tests, and perhaps even more so, they are in very limited supply. And in fact, as we have seen the impact of the Omicron variant, some of the monoclonal antibody treatments are actually not effective against Omicron, Omicron variant. And so the CDC and the NIH have actually advised against using some of the monoclonals if people are sick with the Omicron variant. But what we do have, and there's a monoclonal called sotrovimab that is available, again, in limited supplies, but it is available in hospitals, and we've also put it in nursing homes, again, directing our limited supplies to where the most vulnerable populations are. There are I think in November, 2 new, or December actually, 2 new oral antivirals that were just approved for COVID-19, and Paxlovid is one of them, and molnupiravir is the other one. They're a little hard to say, and so they're a little bit of a tongue twister. These are also provided to the state through an allocation system, so they're not yet, none of these are yet available on the open market, and so we're receiving limited number of doses of these. And so again, we've directed some of them to our partners at Walgreens on the Paxlovid and the molnupiravir, and some to our partners in skilled nursing facilities. So we're directing them to pharmacies that serve those skilled nursing facilities, as well as a limited number of FQHCs. We are getting on the order of, just a few thousand, a week to 2 weeks. So it's very, very limited in terms of the amount of, the number of doses that we're getting. Next slide. This is the last one. So I think that, the key messages here, we've talked about vaccines, boosters, testing, treatment, but I want to underscore the fact that other measures are equally important. And you see me wearing a mask. I'm in a state facility right now, and the governor also instituted a mask requirement for all state facilities last week. So wearing a mask continues to be a very important part of keeping yourself safe. And so we really think about it as, multiple layers of protection to keep us and ourselves and our families as safe as possible. And so wearing a mask is important. And in fact, as the governor announced yesterday, we will begin distributing 20 million N95 and KN95 masks around the state, including through local health departments, at our state-run testing and vaccination sites, through the Vaccine Equity Task Force, nursing homes, as well as we are working in partnership with MSDE as well. So I will end there, and I thank you for your attention, and I'm happy to answer any questions.
Well, thank you, Dr. Chen. We appreciate the update. One quick thing would be, could we possibly get copies of those slides that we could distribute to the members?
Yes.
Okay.
Happy to do that.
Okay. I'm going to ask my membership, the delegation, to please, if they remember how to raise their hand to ask questions. Hopefully they do. It takes a second to get there. The first one I saw, and I don't mean to go out of order, but it's going to be tough, is Delegate Griffith.
Mr. Chairman, Dr. Kane, obviously, thank you for all you've done. It's been a very difficult couple of years for you, and no one's going to fully appreciate everything you've been through. So thank you for all your hard work. I do have a question trying to unpack some of the COVID numbers. I always get uncomfortable when language or definitions change on the fly. And a few months ago, it was individuals hospitalized due to COVID, and that changed kind of subtly to individuals hospitalized with COVID. And I think the reason why is pretty self-evident. But do we know of the people that are hospitalized with COVID, how many of those are hospitalized due to COVID? And then are we going to go back and unpack that back to the beginning of the pandemic?
Yeah, thank you for that question, Delegate, and appreciate your words of encouragement. So I will say that from my perspective and the numbers that we have put out there, the definition and how we've collected that data has not changed. And so, maybe you're sensing a change in language. And yes, there has been discussions more lately of, well, are people incidentally found to have COVID, but they're there for something else? And we are looking at that. I think that some of the early information suggests that, in fact, the majority of people who we have said, are hospitalized with COVID, in fact, do have COVID. They may actually be there, for example, initially for something else, like an asthma exacerbation, but it could be triggered by COVID, for example, or even somebody who has renal failure, that can, diabetes exacerbation can be, people with diabetes, if they have a severe infection, can actually go and not and be more dysregulated because of an underlying infection such as COVID. So it's hard to tease that out, meaning it may not always mean that they are there for severe respiratory symptoms. But I will say, if you look at the people in the ICU and such, those are the individuals with severe respiratory symptoms with COVID. So I guess the bottom line is that what we have looked at, and I don't have the numbers in front of me, is that a very small percentage might be considered incidental, if you will, kind of if they were there for something entirely different, say, and a motor vehicle crash or some other reason that they're incidentally found for COVID. But the majority of people who are in the hospitals are, do have COVID and have, symptoms and consequences because of it. I do not think that we will go back in time to do the analysis because it's pretty detailed analysis. It actually takes a lot of work to unpack all of the data because we're looking almost at the individual patient level, and we've had tens of thousands of people hospitalized with COVID at this point in time.
Thank you. Next up, I have Delegate Sample Hughes.
Thank you, Mr. Chair, and good morning to everyone. Dr. Chen, thank you so much for this presentation. My question is specifically regarding the monoclonal antibodies. So I know you indicated on your slide there's a national shortage. So for the individuals that are in this, specifically nursing home is where I'm going with this, the ones who are testing asymptomatic versus symptomatic, is it more advantageous, or do you see our health providers providing that test, or excuse me, that infusion to persons with the asymptomatic results versus the symptomatic, or does that matter? And then the second half is, do you see our nursing homes having enough to cover the infections or the issues that they're grappling with right now?
So I'll take your your last question first, in that, we are getting very, very limited number of doses. There's, to create, if I understand correctly, there's a manufacturing issue. And, we essentially got our, the number of doses available in the state, cut pretty drastically, only because, we were getting what, you may have heard of the Regeneron product, and there's a bamlanivimab, a Eli Lilly product, but those have been determined, even though those are in pretty good supply and we've been using them all year, they have been found not to be effective against the Omicron variant. And so I've been advised, and we're advising our clinicians not to use those. So those are essentially off the table. So essentially there's only one monoclonal product now, the sotrovimab that I mentioned, and those are in much more limited supply. So we are reserving as many of those doses as we can for the nursing home population, and so many of the doses are going to those nursing home pharmacies that serve them. So we are continuing to ask our federal partners for more of those doses to get into the state. There is, and I think we're looking into this, there's the other product that you may have heard of, remdesivir. This is a product that early on was used for treatment, and it was restricted only to patients who were hospitalized, so the most severely ill. It's now available on the open market because it's been fully approved, et cetera. And so the indications just recently changed to allow for infusion in a nursing home setting. So not that you don't have to be hospitalized anymore. So we are definitely trying to look at that as another alternative for treatment option for nursing home residents. Did I answer both of your questions?
You covered the latter one, but I needed the answer with regarding the asymptomatic versus symptomatic. Is one more advantageous to use this antibody for versus one or the other? And just trying to understand it a little bit better, because a lot of constituents that I'm hearing from that have loved ones in the nursing home are saying this is being offered, but does it make sense for those loved ones that have asymptomatic?
I think that it's really about a timing issue of, if they're exposed and if they're positive, they need to, and have underlying conditions, which everyone in a nursing home does. It is to their benefit if they're offered sotrovimab to receive it, or another treatment, because, whether they're asymptomatic or not, because I think waiting until they're symptomatic may not be helpful. So really, the earlier in the course, as soon as they're diagnosed positive, they should try to access treatment.
And you are guaranteeing that those doses that are no longer beneficial to those patients, I should say, is out of the supply of our providers
There
around the
may
state? Because I
be,
don't want to
yeah,
have
there
any problems.
Right, right. No, so there may be some still being held in the system because, there may be future variants where it could be effective. And so we have not thrown those away, so to speak, but we have put out clinical advisories and, we have ongoing discussions with the pharmacies as well as our clinicians in nursing homes and elsewhere that, to share the NIH advisory that they put out within the last few weeks as we learned more about the Omicron variant.
Okay, thank you. And thank you, Mr. Chair.
Thank you. Next up, I have Delegate Hornberger.
Thank you, Mr. Chair, and thank you, Dr. Chen, for all your hard work. I just wanted to put a plug in for the booster. My wife and I were able to receive it before the end of the year. Didn't get sick, didn't hurt, and it gives us a little bit more peace of mind. So I just encourage everyone out there who haven't to try to go and get the booster. Many of the members of the legislature received the first 2 shots around this time last year, and we're approaching that milestone of the recommended window of time for the booster. So just put in a plug, and thanks for all your hard work.
I should have recorded you so that, or it is being recorded. So maybe we'll use you as a PSA. Thank you.
Great, thanks.
Just looking for a plug, that's all. So good job, Kevin. Next, we have Senator Eckhart.
Thank you very much. And I have 2 questions, Mr. Chairman. First one, a lot of constituents have been talking to me about immunity. So do you know, Dr. Chan, of any research that's going on with regard to immunity? There are discussions about natural immunity, how long it lasts, and then layering on top of that the varying vaccines and then the booster. That's my first question. So we actually have 3. Second question would be, when do we expect the next booster to come out? Because there's discussion about that. And then the third one is, when can we expect additional N95 masks, particularly for our vulnerable populations? And will they come through the health department, or can we make special requests, or what is that? So just those 3 questions. Thank you.
Simple ones. No, thank you, Senator Eckert. So in terms of immunity, a lot of discussion about natural immunity. So, there is a, immunity obviously that develops after an infection. But what they found, and this was a study that was actually published in the summer looking at a pretty large cohort of people, and I'm trying to remember, I think this may have been in Kentucky, showing people that had gotten infected and looking at their reinfection rate the following year. So if they had gotten infected, for example, in 2020 and had documentation of a positive test, et cetera, what was their reinfection rate versus people who were also infected but had gotten vaccinated. And I don't want to quote incorrect numbers, but the rate of infection among people who had gotten the natural immunity plus a vaccine was, much less compared to people who had only had evidence of an infection but did not get vaccinated. So that's why we are encouraging that even if people have evidence of infection, to get vaccinated. Now, what we are seeing now, even with the vaccines, is that immunity appears to wane over time. And so that happens as well with natural immunity. So people who say, well, I got infected and I was fine. I got infected in the first wave, for example, of COVID pandemic in 2020. So I'm totally fine. I got immunity. That immunity appears to wane as well, even natural immunity. So that's why, as we continue to learn more about people's immune responses, this does not, of course, and you are well aware of this, doesn't count people who are immunocompromised that may not have the ability to mount a good immune response to either natural infection or vaccine. So that's why now the recommendation for a booster. Now, in terms of future booster doses, I think things are being looked at now. There may be some information coming out from Israel where they have put out, for certain populations, particularly the vulnerable, an additional fourth booster dose in some cases. So we haven't made that determination here in Maryland, and certainly CDC and FDA have not come out with that recommendation. And then with your last question with the N95 mask, I don't have in front of me the numbers, but we are, as the governor announced yesterday, distributing 20 million N95 plus KN95 masks around the state. And, our overall priority continues to be the vulnerable populations. And so a lot of these masks are going through or will be going through local health departments and local partners. If you, Madam Senator, has a specific request, please let me know and I can try to facilitate that.
Great. Thank you very much. And thank you for all your good work. I know it's a difficult time. We appreciate it. Thank you.
Thank you, Dr. Chan. Thank you, Senator. I have a couple questions for you, Dr. Chan. You give numbers out about saying the peak infection, peak hospitalizations. How do they relate to previous last year's numbers?
Much higher. So I can flat.
They're higher now. They're higher now. Okay.
Yeah. So I don't know, Heather, if you're able to flash up the slide with the hospitalization numbers again. So in a moment, we might be able to bring that up. But, we right now, just Wednesday, we hit our highest total number of hospitalizations, COVID-related hospitalizations ever in the pandemic. So here it is. Thank you. And that was at 3,435. And last year, so our previous peak, and I actually have this in my, burned in my head and have been saying that and using that as a benchmark all last year, was 1,000. Of course, now I've forgotten my benchmark, but was at 1,952. And that was on January 11th, 2021. So it's much, much less. And so you can see on the very far right, the black line is total bed utilization. And you can see it's much, much higher than it has been throughout, going all the way back to March, April 2020.
Has there been any discussion about back when the pandemic first hit, we had all these special locations with hospital beds, and I assume staffing will have an impact on the answer to this. Has there been any thought to doing more of that?
So it is something that we're talking about. So we still have a number of them up and operational, including at Tacoma Park and Laurel, and those are being maximized right now. I think, as you have probably heard around, the entire state, staffing is a big concern for that. And so that's why one of the areas that we're also focused on is discharging. So we are hearing from our hospital partners that there are a number of patients that perhaps no longer need that high level of care. And so we're trying to expedite discharge, again, not just to home and if it's not appropriate, but to the appropriate level of care. So working on nursing homes, if that's the right level of care, or to an alternate site.
Okay. Do you have a number of the percentage of people currently on ventilators?
I do not have that information right now. I know that as of a couple days ago, there were 554, I believe, who were in the ICU. I don't know if all of them were necessarily on ventilators. I don't have the ventilator number right now. I'll ask and see if perhaps MIMS or someone else has that.
Okay. I guess the Supreme Court came out with a decision about not being able to tell people they have to get vaccinated. I think, is that going to have an impact on our hospitals here, or is that a state issue that's handled within the state?
So I think that most of the hospital systems have put in place a vaccine mandate. And so the CMS rule does apply. And I would have to pull that up to make sure that I don't misspeak in terms of exactly which facilities the vaccine requirement applies to. But I think that any CMS regulated space that would include nursing homes and assisted livings, some assisted livings and the like, would be included within that, the CMS rule that the Supreme Court upheld.
Okay. I'm just asking you questions that I get asked every day. I'm not putting you on a spot for anything other than I do get a lot of people calling me on these
No,
things.
they're really good questions, sir. No, I appreciate those questions. We get those as well.
One of the things that keeps coming up to me is about the mask, the N95, KN95. You still see people using other types of masks. And I'm wondering, is there a number you can attach to safety if you're wearing a mask and I'm wearing a mask versus you wearing the best mask and me not wearing a mask at all? Does that make sense?
It does. I don't know if I have those relative risks, I think is what you're saying. You know, I don't have those numbers, and I'm not sure if those exist, but it's a good question to just try to understand, you know, what might be more protective, because people are trying to, you know, do everything that they can to protect themselves. Now, we have heard rumors of, I don't know if this is going to come to fruition, that perhaps the CDC may change its mask recommendations to talk about a more like use of N95s or KN95s that have a better fit, and perhaps do a better job of filtering out these really small particles. And so I have not seen that yet. But here's what I would say is that as we learn more about Omicron, obviously, you know, it is more transmissible. So that's why, you know, in part, you know, in large part, why we are distributing the KN95s and N95s in our possession to get that resource out to people everywhere, because it can be cost prohibitive, and we recognize that. And so we want to get it out and distribute it to the population. It doesn't do any good for us to have it on our shelves. It's better for people to use them. But any mask is better than no mask at all. And so that's why my last slide also included, you know, continued physical distancing, washing your hands, you know, some basic things that, you know, I just want to keep reminding people of. So I appreciate your questions. I don't have, though, I think the relative risk or benefits of one mask over another in front of me. I'll see if I have that, or if I can get that from our environmental health director.
Okay.
As
far as our students and our children, is there any information or any data you have as to the comments we hear about oxygen deprivation and what it's doing to our children, and if that's a concern at all to the health department?
So I think in a word, no. You know, there is no data at all to suggest that wearing of masks for prolonged periods of time results in, you know, low oxygen levels for anyone who wears it, or high carbon dioxide levels. There is absolutely no data to support that. I think it's something, you know, I mean, obviously, if that were the case, I would be passed out right now. I've been wearing the mask for a couple of hours now. And talking.
I think part of the point is the people that come up to me are sitting back saying, you know, my child is doing this, my child's doing that. It may not be damaging, it may not be passing you out right now, but certainly we monitor oxygen levels in everybody. I think you see it every day. You see people with the thing on their finger, and they got to monitor that. And that continued deprivation, if there is one, and have there been studies absolutely done on that you're aware of?
Yes, there have been a few studies done looking at oxygen levels. There was one that I think has been reported showing, you know, that perhaps there's an increase in carbon dioxide that I was aware of, but the methodology has been, you know, was not an appropriate methodology to really make that claim. So there have been a few that have looked at that specific issue.
Okay, my last question for you is this. I've been involved in hospitals over the years through relationships or whatever, and I'm amazed that certain things happen. And I guess my biggest thing is well, actually two things. One, I'm very surprised that we can't get these antibiotics or whatever it is. I'm very surprised that they're not we don't have masses of them available, based on the fact that we could develop a vaccine in less than a year. That confuses me and concerns me that these aren't readily available. And we also hear that certain medications are not being honored, but yet they're being dismissed and not being made available to the public. If it's working for some, shouldn't it be available to all?
I think that the medications that we make available to the public, to the people who are the most vulnerable and at risk for complications of COVID-19, are the ones that have gone through clinical trials and shown benefit to a larger population. I would really be hesitant, and I don't feel that it's professionally responsible for me to make a recommendation for a medication that I only have anecdotal information about.
But we did that with the vaccine. It didn't go through clinical trials. I mean, it's gone through a lot now. It didn't in the
No, it
beginning.
actually did. There were, actually many of the clinical trials for the vaccines were larger than clinical trials for other vaccines, for the COVID vaccines were larger than the clinical trials for other vaccines. And so, but, there are clinical trials for a number of the therapeutics. And so, and were approved under emergency use authorization.
I think that's a perception that's out there, that this thing was just thrown at us, and I'm fine with that. I mean, I just want to bring it up because people are asking those types of questions. I have about 28 more, but I think we have a couple other people who want to ask questions, but I do appreciate your answers. Delegate Grice is next.
Right. Thank you. Yeah, we know obviously with Omicron that it's very contagious, and it's also much less virulent than Delta and I think the other variants that have been out there. In fact, what we've seen so far, at least in South Africa, it came on very quickly, and it also dissipated very quickly. And then we're seeing that dissipation happen right now in Europe. Do you suspect that we'll see the same thing here in the United States, Maryland? And I guess my second follow-up question will be, are there any other variants out there that you're aware of that we have to be concerned about? And yes, if this thing does go away quickly here in Maryland, I mean, are you starting to see a light at the end of the tunnel for us?
Very good questions. So, and so thank you, Delegate Grice. We have seen what the curves look like in South Africa as well as in Europe, and are optimistic that perhaps we'll begin to see that here. We are just beginning to see perhaps a slight leveling off of some of our indicators, but it's really too early to say for sure whether that's the case. And, of course, as we talk to our hospital partners on a daily basis, they are still experiencing a huge surge, and that's really difficult to manage. And that's really our top priority right now, because, while we're focused on COVID, what's really concerning to me is also people who have other conditions that perhaps don't have bed space or don't have the ability to get cared for in a timely fashion. And so possibly, we may see a similar curve as to the UK and South Africa, but still too early to tell. I think in terms of other variants, variants are a tricky thing. It's my lab director has kind of made, and maybe this is apropos to Maryland, compared it to trying to pick a winner in a horse race. And so, yes, there are other variants that have been identified out there that have kind of made the news or have been brought to our attention. There's one, I think, in France. There's one in Cyprus that might have some combination of mutations from both Delta and Omicron. But it's hard to say whether or not those will take off, if you will. The Delta variant, and I don't know if you're aware of this, our very first case of Delta was actually identified in April of last year, just as a, for your information. And yet it wasn't called Delta because nobody really talked about Delta until probably a month or two later, when we saw what was happening in India and then in other countries. So it's very hard to pick what's the next thing, but we anticipate that it will continue to evolve as it has for the last 2 years. So thank you for those questions.
Thank you. I think our last question will be from Senator Eckhart. She's getting another bite of the apple.
Thank you very much, and I appreciate that. Real quick one. There's been a lot of discussion about the Omicron because of its rapid transmission, that we need to be very sensitive to hand washing, personal hygiene, and making sure that surfaces are sanitized. Is that accurate?
Yes, I mean, I think that those basic precautions are still very important. What we have been learning about Omicron and even with Delta is that perhaps the airborne transmission is more, plays a larger role in transmission versus, on surfaces and such. So, I would never put out a message to say, don't, stop cleaning surfaces, because that's important, not just for COVID, but for a whole host of other things. And I would just put a little plug in that flu. We're actually seeing more flu this year. There was almost, flu was nearly non-existent last year because, everybody was masking and still being very, very cautious in terms of travel and such. But with, a lower mask usage now, increased travel and such, we are seeing increase in hospitalizations for flu. Now, not at the levels that we're seeing for COVID-19, but just be aware of that. So yes, I think, continue to clean surfaces. Washing hands is important because hands can transfer to to your nose and eyes, as you well know. But airborne appears to be a major transmission route, which is why masking is important.
Thank you very much. Thank you, Mr. Chair.
Thank you. Dr. Chan, thank you very much for the answers to the question. As I said, I hear a lot of things out there, and a lot of people don't get all the details that we need to express to them. But thank you for your time, and we really appreciate it. And if you could have those slides sent to me, I can distribute them to the delegation.
We will. And thank you so much. I'm happy to talk to you anytime. A lot of really good questions and more that we're learning every day. So appreciate it and appreciate your time, and hope everyone has a good session.
Thank you very much. All right. Up next, ladies and gentlemen and people, we have Senator Ben Cardin. Senator, are you with us?
Mr. Chairman, I'm with you. Thank you very much. It's always a pleasure. I'm sorry we cannot be in person, but that's the realities of which we're working under. But I look forward to the personal interaction, and hopefully we'll be able to get that sometime during this session. I am joined with Kim Cradovell, who I hope you all know, who are my eyes and ears on the Eastern Shore of Maryland. And I try to do this at least once during every session to let you know that this really is Team Maryland. And we look forward to working with the Eastern Shore delegation and our colleagues at state government as we deal with the national issues. Clearly, Team Maryland, your federal delegation, we work very closely together. I see Mike's on the call in regards to Congressman Harris's office. We work very closely with Senator Van Hollen, and we share responsibility. And we've had several meetings dealing with many of the critical issues, including the H-2B visas and J-1 visitor visas, as well as some of the Bay issues and other issues affecting the Eastern Shore of Maryland. As you start this session, we are still dealing with COVID-19. The federal government, as you know, made an unprecedented amount of money available to state and local governments as a result of COVID-19. It started with the CARES Act in March of 2020 and continued through the American Rescue Plan in March of 2021. I had Mike Thomas, I don't know if Mike's on the call, or Mike is on the call, Mike Thomas in my office update our information that we had previously made available to you in regards to the CARES Act funding and the American Rescue Plan funding. And I believe today he has, it's on our website and has been made available to all of your offices, an update as to the resources under the American Rescue Plan that are available to you. And there are many different categories of funds. Yes, the largest single funds are the basically flexible funds that were made available to the state of Maryland and the counties and our municipalities. It totals $6.335 billion. And the reasons why our state and counties are not having challenges as far as balancing their budget and carrying out essential functions is because of that relief package, the CARES Act and the American Rescue Plan. We had the breakdown for each of your counties and all your municipalities that are in there. These funds are flexible funds. Just last week, the Department of Treasury issued additional guidelines to help our local governments as to how those funds can be used. Now, in addition to that, we provided categorical aid, including money for our educational systems, which are substantial, monies for our healthcare system, money for housing needs, and the list goes on and on and on that were included in the American Rescue Plan. But I also want to underscore the bipartisan infrastructure package because those funds are just now being distributed. Maryland will receive in total over $6 billion as a result of the infrastructure package. That's a huge sum of money. And again, it's going to allow you to do things that have been held up for a long time. The road and highway program is $4 billion alone coming to Maryland, just for roads and highways. Bridge repairs, $409 million. We announced yesterday, I guess it was Thursday, the initial funds coming into the state of Maryland for bridge repair. And I know on the Eastern Shore, we have many bridges that are in need of attention. Those funds are now available. So yes, I know that the governor will be making some of these announcements, but he can make these announcements because of the federal funds. And we know that this is a bipartisan effort to rebuild our infrastructure. There's a significant amount of money coming to Maryland in regards to broadband as a result of that. $100 million minimum coming to our state for access to broadband, which is critically important on the Eastern Shore of Maryland. We have Chesapeake Bay restoration funds, $238 million. That's an unprecedented sum. We had the assistant secretary that's responsible for the Army Corps before us this past week, and I questioned him on the use of these funds for Chesapeake Bay programs. Recognize that our annual Chesapeake Bay appropriation is somewhere around $85 to $90 million a year. This is $238 million made available under the infrastructure package to help us deal with the Chesapeake Bay program. Under previous law and this law, there's monies available for our airports. Salisbury will be getting a substantial sum of money as a result of this legislation. And we have all the different categorical areas available for you in regards to the infrastructure package. We're still working on the Build Back Better budget. That is a work in progress that would deal with the cost for families. As you may be aware, the child credit payments that were being received on the 15th of the month ended January 15th. We're looking at extending that. We're also looking at universal pre-K, childcare expenses, housing expenses, and additional help for small businesses. This package will be 100% paid for. We guarantee that, and it really will be paid for. And then lastly, on the appropriation side, I just really want to report to you that for the first time, we have congressional earmarks. Now, we haven't reached the finish line yet, so it's not done. But in the initial markups from the Appropriations Committee in the Senate side, the Eastern Shore received from our office about $51 million in earmarks, including a very important appropriation for Mid-Bay to get Mid-Bay construction started. As you know, Poplar Island is reaching its maximum, and we need to get actually construction funds in regards to Mid-Bay. We have $37 million, which is a substantial amount of money to get started on the Mid-Bay construction to make sure that we don't lose anything in regards to the ability to have dredge sites for the dredging of our harbors, but also the environmental restoration, which is popular for the location of the dredge material. We also have money in here for Federalsburg Choptank Community Health Center. We have money in here for Bakua Creek watershed restoration. There's money in here for the 411 kitchen in Cambridge. There's money in here for the city of Cambridge to replace its highest priority sewer lines. And there's money in here to establish an interdisciplinary research center at the UMES, monies for supporting oyster aquaculture and restoration programs in Maryland, money for the Oxford Lab, and money for Pocomoke River Somerset survey. So just point those out. These are an example of some of the projects. There's more in there, but the 2022 earmark process was on the fly. We didn't have any preliminary opportunities to advise you as to how those funds would be distributed. Mike Thomas of my office has put together a guide in regards to the FY23 earmark process, and we want to make sure that you are aware of that. There's a limited opportunities for this. They're basically for local governments and nonprofits, and there are different categorical areas that we can help you move forward, and we want you to be aware of that in plenty of time for this year's appropriation process. As I mentioned initially, there's no higher priority for our delegation in regards to the Eastern Shore than the H-2B. We were extremely disappointed by the announcement made by the administration on the initial allocation. It was not fair to the Eastern Shore, it was not fair to this country, and our delegation has so noted that, and we're working very hard to get that rectified. We know we need reforms. We have bipartisan support in the Senate to move this along. Senator Van Hollen and I are working very aggressively on this. Congressman Harris is working very aggressively on this. This is one of our highest priorities, to deal with the workforce issues with the H-2Bs and also the J-1 visitor visas, which is critically important for Ocean City and other areas. We recognize that. So we're very laser focused on those issues. And as always, we look forward to working as closely as we can with you. Feel comfortable at any time to reach out. We want to work together. We want to bring our state and nation together in trying to move our country forward. And I look forward to working with you, and I wish you a very productive session. And if time permits, Mr. Chairman, I'm more than happy to try to respond to questions or listen to your concerns.
All right, thank you, Senator. We appreciate that greatly. I'm not seeing any hands yet, but I do have a question for you, or a statement, I guess. When we talk about these dollars and cents for infrastructure and what have you, is there anything you all at the federal level can do to help us with our Bay Bridge issue? We've asked this every year we've been meeting that I know of. We've talked to you all about it. Is there anything you could personally earmark to make sure our Bay Bridge study gets finished, done, and there's dollars allocated for that?
Well, it's a little bit complicated because the Bay Bridge works under a toll authority, and therefore the funding of it is different than a typical project because it has independent funding sources related to the toll facilities, which are unified in Maryland. All the toll facilities work in conjunction. We do have the ability under the formula funding. The infrastructure bill provides substantial funds to Maryland under formula funded programs. That's about $4 billion, if I remember correctly. So there's going to be some flexible funds coming to Maryland that they can allocate for purposes. And I believe the Bay Bridge study could come out of that. And then there are competitive funds that are available. So yes, there are a lot of different avenues that are available here on both the competitive and formula side. And then additionally, we can look at earmarks. So I would not rule out any of those avenues as trying to help you, and we'll be glad to work with you on that. But I do point out, because of its independent funding flow, typically this has been done through the tolls and the revenue authorities.
Well, as you know, that hasn't worked over the years, and we seem to be roadblocked on a lot of this, if you get my drift.
I got you.
The other thing, I always say this, I've probably said it to you, is I appreciate the fact that we're getting all this funding and the federal government's been able to step up, but there is a cost to all this. And I think, you know, back when I was a county commissioner, I used to talk about grants, and we say, well, if we don't use it, somebody else will. But I do think people have to understand that nothing we're doing right now is free, and every dollar that you're giving us are tax dollars from the public and the people. And I think that's important to keep in mind. But I do appreciate your service.
Well, on that point, let me point out, we do have inflationary trends right now, and we have to make sure that we have real offsets to any additional spending that we do. So I'm with you on that.
Okay, thank you. Any other questions for the senator? Oh, Delegate Sample Hughes.
Thank you, Mr. Chair. And I know my good friend Delegate Jacobs is waving his hand vigorously, so don't overlook him. But thank you, Senator Cardin, for being here today. And I just want to really highlight the fact that, you know, we have, as you are aware, keen needs on the Eastern Shore infrastructure. So to put that emphasis in and to make sure those bridges and roads are really getting addressed is greatly appreciated, as well as certainly our airport and the emphasis on the Chesapeake Bay. Just wanting to thank you for the document that you've provided for the guidance, because when we're going around to the various municipalities and the counties, they are eager and wanting and knowing they need to use the money, but they're very hesitant and making sure they're not making any mistakes and going in a direction that may not be the appropriate way to utilize the funds, as far as specifically their sewer projects and over at East Newmarket and some other places around the district. But this document, I'm going to certainly help get that word out. But I do appreciate having that, because it provides clarity for me as well, because on Monday I'll be speaking to a group from Worcester County, and they were asking for the same type of information. So thank you for all you're doing. I know you're working extremely hard, and appreciate your emphasis for the Eastern Shore.
Well, thanks for your comments. We can help you with the water grants and the use of water funds through EPA. Adam Ortiz from Maryland is the regional administrator, Region 3 administrator of EPA. So we have a local person now at the top of our of the region for Environmental Protection Agency. We met with him this week, our delegation, and he is laser focused on the Chesapeake Bay and other issues affecting Maryland. And we can certainly work with you with the Treasury Department in regards to the guidelines on the use of those funds. I see Jim Mathias is on the line. I just want to acknowledge UMES and its what it did in regards to diversity with pilots. It was really a national effort that it's made, and it's been recognized as really providing a critical workforce need that we have in our country, and doing in a way that we can increase diversity. So congratulations to UMES.
Okay, last question, Senator, will be from Delegate Jay Jacobs.
Thank you, Mr. Chairman, and thank you, Speaker Pro Tem Sample Hughes, for recognizing me. But, you know, it was a perfect segue into my question, Mr. Senator, your last comments about the Bay and about the water. But as you know, we've had an ongoing problem with the Conowingo Dam, or not the dam so much as the Susquehanna River, I should say. And, you know, we've talked, I did get a very nice Eastern Shore guide, 23-page guide on the ARP issues, very detailed. This sent to my office. I appreciate that. But getting back to the infrastructure bill, is there any movement in that whatsoever to address any of the dredging of the reservoir on the other side of the Conowingo? As you know, 40% of the fresh water comes into Chesapeake Bay every day across that dam. And we've had a lot of problems this fall, especially with dead zones in the upper bay, and not just the upper bay, but many parts of the bay. But this is, an ongoing problem, and they just ratified a 50-year lease with virtually no effort in it whatsoever to dredge any of that reservoir. So I'm wondering if, I've always thought that the federal government was going to have to be the one to bail this situation out. So I'm just wondering if there was any funds in the infrastructure plan to address any of that dredging.
Well, there are funding sources that could deal with the Conowingo Dam, and there's funding sources that could deal with the Susquehanna River. Unprecedented increases of capacity by the Army Corps to be able to take on these projects. And as I said, we had the Assistant Secretary and the General who's in charge of the Army Corps before us this week. And we did talk about those types of projects. But I want to raise two issues in regards to that. First, Pennsylvania has to do a better job. They're not doing what they need to do along the Susquehanna. That was the main reason why we had the delegation meeting with Adam Ortiz this week, to push the Environmental Protection Agency in the review of the watershed implementation plan for Pennsylvania to make sure that they do what they should be doing. Maryland farmers are doing they're doing what needs to be done. Pennsylvania farmers are not. I mean, that's just the facts. Pennsylvania could do a lot more. Pennsylvania has the capacity to do a lot more. Pennsylvania made a commitment to do a lot more. So we want to hold them to that commitment. So I just really want to stress, and I did something that was unprecedented. I used one of my congressional earmarks for money for Pennsylvania to deal with the Susquehanna River pollution issues, because I knew how important it was for downstream. That's issue number one. Issue two is that there's an engineering challenge as to how to handle the dam itself. The Conowingo Dam is critically important for energy. It's the second largest energy source of aquatic energy source on the eastern coast of the United States, next to Niagara Falls. It is a critically important dam, but the way that they did the dredge, the way they did with sediment control is over capacity. So one of the issues is to dredge. Other issues is to look for different ways of dealing with it. The bottom line is we have not yet come to conclusion as to what is the best engineering solution here. There's a disagreement among scientists, and we have to resolve that and then implement it. And the fundings are available for it. I also agree with you. I think we missed an opportunity during the licensure process to get greater commitments from Exelon in regards to their responsibility on it. But we will look at every avenue available, because you're 100% right. We have to have all the stakeholders doing what is necessary to protect the bay. And we don't want to lose the progress we've made by the sacrifices our farmers have made on the eastern shore of Maryland by the failure to deal with the pollution coming upstream. So we're on this. This is a high priority for us.
Well, you certainly are. And I really appreciate your comments about how Pennsylvania has been woefully short in their efforts. And, that's one of the big concerns for me in Maryland. We're downstream. So we're putting our dollars out there doing our work, and that can be washed away, so to speak, pretty quickly by efforts upstream not taking place. So I do appreciate the earmark that you use for Pennsylvania. It really does affect Maryland, and we just keep our eye on this thing. The dam just doesn't have trapping capacity right now, and we've definitely felt the effects this fall in the bay. There were more dead zones than I've ever seen in my lifetime, really. And it's very concerning early on in this 50-year lease. So again, thank you for all your efforts. I can tell you're on top of it by the comments you made, and I do appreciate it.
Thank you. I appreciate those comments. Also acknowledge Carlton Atkinson's on the call. I see him, my state director. And Mr. Chairman, I know you have limited time, but if there are other questions or other things that we can help you with, please feel free to reach out to Kim or directly to any one of us, and we'll try to get you that information. And we certainly want to work together in partnership.
All right. Thank you, Senator. We really appreciate your time. Have a great week. Good luck down there.
Thank you.
All right. Finally, ladies and gentlemen, I think if we could just get to our other federal partners, if they have anything briefly to say. We're running a little bit over. Mike, are you out there? Melissa?
In the interest of time, I'll keep it brief. Just check your inboxes. I've been flooding them recently. We have webinars coming up on the outreach for the congressionally directed spending process for both nonprofits and the counties and municipalities. So if you can share that broadly, we'd appreciate it. And thank you. Senator Cardin did a great job updating the federal priorities and the collaboration between our offices. So thank you.
Thank you.
And I'll just tag on to what Melissa just said. And, we work well together as a federal delegation here on the shore. So just keep us all informed of any needs that we're unaware of. And I appreciate the acknowledgement, Senator Cardin, and hope you have a great day.
All right, ladies and gentlemen, I think we're running a bit over right now, so I'm going to end the meeting unless there's any urgent need with the business of the people here. Nothing being said. All right, thank you for your time. We'll talk to you next Friday.
Thank you all.